Hello, everybody. Welcome to the Ocular Insider podcast, the podcast about the dry eye and more. And I would like to welcome you for the new season of the podcast. It's the second season of the Ocular Insider podcast in 2026. And I'm very happy to record the first episode with my special guest today here with Cristina Pac from Romania.
Hello.
I think those who already watch it or looking on our podcast, you already see some of nice discussions we have. And I think we have a very interesting topics today. And we are recording in a nice place of APAC meeting in Hong Kong during an APAC meeting 2026. So welcome, Cristina. Nice to have you again here with us.
Thank you for inviting me.
Yeah, and I hope that all of you will enjoy interesting topics that we will be talking today, because we just recently came also from third youth meeting in the Bangalore in India and now in Asia Pacific. So we would like to probably talk and touch a little bit how the two words, seeing the dry eye from perspective of Europe and yours and a lot of experience. So Cristina, how are you doing today?
I'm doing very well, thank you. It's my first time in Asia, actually. DOS conference was the first conference that I attended in India, so it was very interesting. And the APAC meeting is my first also. So I'm very excited to all the new things that I see here, but also very happy to see that the medical principles are the same all over the place.
Yeah, that's great to see.
Yeah.
And also now you have this availability to compare. So how you can tell us a little bit from your perspective, how it's India or Asia Pacific compares to Europe in a knowledge of the dry eye, the treatment, abilities, the way the doctors are discussing. So what is your opinion?
Well, I believe that the treatment methods are quite the same everywhere in Europe and in India and Asia also, but and also the medical perspective are quite the same. But what worries me is a lack of information among the doctors regarding dry eye disease, and that's what I was talking to you, Peter, in the last days. The fact that many doctors do not take this seriously, and they just treat patients with artificial tears that do not cover all their needs. So that may be affecting the compliance of the patient for the next treatment possibilities that they have.
Right, so I see there's a lot of space for improvement. So what have been your discussions during these days? I know that you discussed with some of the doctors, you visit India, you went to the hospitals.
Yes.
What is your first impressions about a level of medical care? Probably is very high, but you as a doctor, being in industry already a couple of years. So what is your
Well, I would talk more with the doctors to make them understand that dry eye disease is a serious condition, to make them understand that patient needs a very individualized therapy, because patients are different. And I will just say it all over the place and everywhere that dry eye disease is not about artificial tears, sadly. And I'm doing that at home, trying to convince the doctors that patients need to be treated not only with artificial tears, but also with other therapies, just like IPL treatment. Also, patients who have different kind of surgeries, like refractive surgery, cataract surgeries, patients that have to have a biometry well done, patients that stay more than 6 hours per day in the computer, patients that are having a glaucoma treatment. So we could just take each of these category and discuss it separately, because the problem is the same.
When you see these discussions also in Bangalore, was it something that attract you? Because I know that you also you are a fan of PRP treatment.
Yes.
Was it something that you really highlight at least from the discussions over there?
Yes, I would like to highlight the fact that every treatment has to be done properly. For example, the IPL treatment has a 4 sessions protocol that to be respected, or else your outcomes won't be that good as they could be. For example, in my studies, patients that have the whole treatment done, the 4 session of IPL treatment, they do not need less than 10% of the patients need a retreatment afterwards in the first year.
Okay.
But from the other doctors' perspective, that did not stick to the protocol, 50% of the patients needed a retreatment. So that is very frustrating also for the patient and also for the doctor. So first of all, stick to the to the plan, to the protocol, to have the best results, because these protocols are very well studied and are people were spending a lot of time to think about these protocols. So don't make it a shortcut. Just go for the protocol. You'll be better.
We see some comments that the doctors were trying just to do one session.
Yes,
And
they were doing one session, seeing how the patient feels, and if the patient doesn't feel good enough, they were doing the other session like in 2 months afterwards. And you cannot take, like I'm telling to my patients that after the first session, you won't feel anything. After the second session, you won't feel anything. You might find a difference after the third session.
Okay.
So if they're doing only one session, the probability of the patient to not feel anything is more than 90%. So the patient goes and says that I did the treatment, I paid that money, and I don't feel any difference.
Yeah, it's interesting because what we always say that the cumulative effect with the different treatment, abilities of our technology also give a different stage of the improvement of this lens. You start with the yellow, red light, invisible, and each one has a different, time that is absorbed in a human body. Also, it's reflection of the glands on this treatment. So, what is your, the best experiences? How quickly people, let's say, they see the difference between the treatments?
Yeah. Well, most of them feel it after the third session. And almost everyone feels a difference in the first 3 months after the completion of the treatment. Some of them that have a more severe dry eye feel the difference after the first session, but not very many, not so many. So that's why I don't give false hopes to the patients.
What was also interesting during our discussion with the customers and the patients during these conferences, I see, like you exactly mentioned, wow, it's a really this information about the dry eye. There was a doctor coming, and he asked, "Oh, I want to see the collaterals of the Demodex."
Oh, yeah.
And we made him a screening, and was suddenly to show him that he has a Demodex. He was the one. Was very interesting to show him. Yes, you are the. You are the patient. So
the happily possessor of Demodex. Yes.
So I've been a lot of discussion during these days about the Demodex as well, especially. So what are your best practice for Demodex? So let's get rid of it.
Get rid of it? Yeah. Well, I do. Usually when I find a patient has Demodex, disregarding the symptomatology, even if he or she has the symptoms or not, I do the IPL treatment at least 2 sessions. Honestly, I do them all, the 4 of them, but many doctors do only 2. And I explain to the patient that will make you feel better for a while, for 1 year or 2 years, before these parasites are starting to multiply themselves again. So maybe after 2 years, you'll need to do another session of treatment.
Okay, do you also recommend the cleaning and other things like
usually at the beginning I do the cleaning also, but it's not necessary, because if you're doing the treatment and the parasite is not there anymore, then you don't have to focus on that.
I was an interesting topic I found also during this conference is always talking about the age of the patient. And we see a lot of interesting approaches from the doctors with the very young patients, 3-4 years old. But of course, I understood those patients was desperately looking for the help, and IPL was the solution. What is your opinion for the age of the patient?
I don't have problems with treating children with IPL because it's non-invasive, it's easy to use. The children are don't feel any discomfort. So yeah, I would go for even the children and young ages also.
Would you decrease the energy?
No, I would not, because the skin is the same. It absorbs the same amount level of energy, so I would go for the same energy. Maybe I won't do 5 shots. Maybe I do 4, but
No, it's not. I don't think there would be a problem.
Is it difficult to explain the parents the procedures?
as long as you trust the treatment and parents see that you are very comfortable and confident in doing the treatment for their children, it's no problem. I did to some of the children, and the parents were lying beside them, so they saw everything that I did, and it was all right.
Okay. So how, in your cases, when you did the treatment for the patient, how was your outcome?
Very good. The kids were just happy. They were, like, after 3 months, they were so happy they could read very quickly. They could do whatever they wanted to do, and they even went swimming. They spent time outside. The screen time was even improved, you know. We always have a talk with them, and I say, I don't do this treatment for you to play more on the computer, you know, because that's what we are talking about out there. But they felt much better.
What I also found interesting in this comparison between the Middle East and India, do you think that environment where the people living is also playing a big role?
It plays a huge role, because dry eye disease is a multifactorial disease. So it matters the humidity where you're staying, home humidity, environment humidity. It matters what you're doing every day. The climate has a huge impact on our ocular surface. So yes, it's very important.
So,
but see, the frequency of this particular disease, it's quite high. It's quite high, even in Europe and in Asia also. So
yeah, I'm thinking it's coming very common together, combining the myopic treatment and the children on computers, televisions, or at small gadgets that they are always in games. Even our children, it's very hard to take it off from them. So what would be your suggestion for the parents?
Regarding screen?
Yeah.
Well, I have a child who's 80 years old. Peter knows him. So he's not allowed to play on the computer and whatever during the week, only in holidays. But during the week, he's not allowed to stay in front of the screens. Only during the weekend, he stays for half an hour on Saturday and half an hour on Sunday. It's not easy because he has friends and we have families that we meet with, and he sees differences. But I think that if you can explain to the child what's the purpose of the rules that you are putting in his life, he will cope much better. So I am trying to explain, not that you're not allowed to watch screens and so, but I'm trying to explain what's the purpose of you playing that game, you know? What's this going to help you or not? And what could you do instead of playing, you know? But it's easier for the parents to leave the children in front of screens because they are much free. And it's harder for them to make a program for the children. But as long as you manage to transform this time into other activities, then the kid won't need them. For example, our son had a strange reaction when we said, now you have to give me the phone, it's time for you to stop playing. That was years before. He had a very strange reaction. He started crying and being violent. So me and my husband said, well, if this screen is causing you this reaction, then you won't have the screen for 3 months. He did not understand at the beginning. We explained to him. And afterwards, 3 months passed, 6 months passed, and we forgot, and the child also forgot. And after 6 months, he saw someone playing, and he asked, Mom, are those 3 months already gone or not? You know, and that's when we realized that 6 months have passed, and he did not ask for any screens, but it's a real thing to make his program, you know.
I would think that, you know, we would be like when I was in army, we put a 3 months program, and here I put I'm getting home. So I circle the date when when I can have my telephone to play with. So it's interesting. I think probably it's not about the children. It's about the parents, how they taking the problem, the education. So what would be your advice for doctors who want to start with the dry eye, really take it serious?
Yes, well, for doctors who start doing IPL, for example, and treating dry eye more seriously, I would advise them to arm with a lot of patients, because patients are chronic patients, so they need your attention and they need your time. And the proper counseling is the secret into dry eye disease treatment, because you have to counsel the patient to know their expectations. You have to train their expectations. You have to be there for them. For example, they have my number and they tell me every time they have a problem, and I have to answer to them. So when you want to treat dry eye seriously, you take it as a chronic disease and you explain to the patients it's like treating your blood pressure, it's like treating diabetes, it's like treating glaucoma. It's a constant treatment with ups and downs. And our target is for you to feel better from year to year. So I'm telling my patients, okay, you're getting into 1 year program. In this year, I'm trying to make you feel better. It takes me 6 months to establish a proper treatment for you. I won't find it from the beginning. I will do some tests. I will try to individualize your treatment. But it takes me 6 months and you'll see the results after 1 year. And as long as they understand this, they are much more compliant to the treatment.
Great. I think it's a nice closure of our today's discussion, and I'm very happy to have you today, Cristina, and also sharing your deep knowledge and experiences that you have in treating dry eye. And I'm happy that we can still keep something for maybe next part of the year. I'm sure. So hope that all of you enjoy, and please give us the tag and follow us in YouTube and Spotify, and I'm hopefully that you will be looking for the next episode. And with this second series of the Ocular Insider.
And he will also post some pictures from Hong Kong, because he's been the perfect guide.
Oh, that's the different story. So thank you so much for watching us, and I hope that we'll see you in the next episode this year. So goodbye from Hong Kong, and see you soon with the new episode. Bye. Thank you.